I'm joined now by AGA Institute Council Chair-Elect Dr. Maria Abreu. Thank you so much for being here.
Oh, it's my pleasure.
I know you were instrumental in planning the AGA program here at DDW. Can you talk about some of the highlights?
Sure. Well, as you know, the AGA has a large constituency that consists of both clinicians as well as basic scientists, and we're really proud to put on a program that really offers something for everyone. From the clinicians' standpoint, I think really the centerpiece is our postgraduate course, which is awesome. The goal of it is for people to come to that postgraduate course, spend a day and a half, and really be able to go back to their practices having learned all the latest things that are happening in the diverse fields of gastroenterology.
And what is the focus of that program this year?
Well, it's really the evidence that underpins the clinical stuff that we're doing. And so Doug Corley and Jacqueline O'Leary have done a great program for a day and a half. In particular, I want to highlight the fact that in the afternoons, there'll be breakout sessions so that people can actually pick what they're particularly interested in, because we know that there are so many different fields of GI that are advancing that we want to make sure everyone gets whatever they came for.
Right, and addressing some of the challenges really in clinical practice right now.
Absolutely.
And what are those?
Well, there are so many different challenges in clinical practice. At this meeting, of course, people will discuss the finances of medicine, all the things that are happening in healthcare more broadly. But of course, I think that every field has expanded so dramatically. When you think about things like hepatitis C being cured, all the new drugs that we have for inflammatory bowel disease, and other things that are really kind of going by the wayside that that we're seeing less of, thankfully, because we're doing so much better at screening for different conditions. So again, I think all of that will be highlighted and people will be able to go back and implement that in their practices. The other thing that I think is really advancing is the basic sciences, and it's our responsibility in the AGA really to advance the science of gastroenterology. Without that, really, we're not going to make really big advances in human healthcare. And so to that end, we have, I think, a great program for the basic scientists as well. Most of it is going to happen on Monday, and importantly, we've gone to great lengths to actually cluster them together in one area of the convention center so they're not running around, and so that people can interact in between sessions with other scientists, which we know is important to them as well.
And I know you're also talking about some special interest paths.
Yeah, so it's very important. DDW inherently is hard to navigate because we have so many offerings going on simultaneously. It's the appeal, but also the challenge. And so we have, I think, again, are always trying to make that better. If you go to my DDW Planner, or if you use the My DDW app, you'll see that there are different tracks that may appeal to you. If you're a fellow or a young GI, there's a track for you that tells you for each time slot what we might suggest you participate in. If you're interested, for example, in inflammatory bowel disease, where there's a lot of programming, you can pick that a clinician track or basic science track where an expert in the field has culled out for you the important things that are happening. The other thing I actually wanted to show you, Dina, is that at the information booth that you can pick this up, this AGA highlights at DDW. And I really like to have things really simplified for me. I'm not that clever. And so in this booklet, the people who organized it did a great job of highlighting for each time slot what's happening and color coding it so that you can just pick up this very nice little brochure, thumb through it, and be able to find your way here at DDW.
And I know one of the things you were excited about were these Meet the Professor lunches.
Oh yeah, well, I'm all about food. And usually I'm so exhausted and so hungry by noon that I just want to eat something. And so if you're hungry and you haven't signed up for a Meet the Professor, Meet the Investigator lunch, but you want to learn something, you want to have a hot meal, get CME credit, all those great things, it's never too late. Actually, you can sign up on the spot. There's an area here at the convention center where all the Meet the Professor and Meet the Investigator lunches will be, and actually they'll take your money right away and you can just attend whatever is open. So I think you don't have to have planned it wherever you came from. You can do it on the spot.
It sounds so exciting. Can you discuss to me why you are so happy about this idea of sort of advancing and making clinical practice easier and using that unique AGA focus on basic science to be able to better cater to patients?
Absolutely. My motto is that, science is the ability to touch patients that you'll never see. And so to that end, I love gastroenterology. I have a field of interest in inflammatory bowel disease, but I love all of gastroenterology. And I love the energy that I feel when I go and listen to people presenting their basic science work, right? Or clinical work. You know, these 15-minute, the abstract presentations. A lot of people, especially clinicians, go to hear famous speakers at a meeting like this. But I would say to you, try going to some of these research forums where these young people, mostly young people, are presenting their primary work, and see how anxious they are presenting that work, because really it's a labor of love sometimes to get this done. And as you well know, the NIH dollars are hard to come by, and so we really want to foster people who are going to be making these discoveries in the future, and not have them become despondent about this transient time now that where funding is a bit hard. And
it gives you a focus on the future, and I think options to give to your patients.
Absolutely, absolutely. And I think patients love when you can speak to them about the latest research. Patients are becoming very sophisticated. We have Dr. Google, so everyone really is a doctor anyway, and so you have to stay one step ahead of them. And I think that coming to DDW and making this investment in time is really a tremendous investment for the rest of the year. You can show off to your patients for at least a good year until you come back next May.
It's a great forum to do that and learn so much more and interact with your fellow physicians. Thank you so much for joining us, Dr. Abreu.